Now, long COVID represents the constellation of long-term health effects of COVID-19. It is a multi-system disorder that can affect nearly every organ system. It affects the brain, it affects the heart, it affects the endocrine system, it affects the immune system, it affects the GI system. Long COVID affects at least 20 million Americans. It affects people across the lifespan. We have kids with long COVID. We have people who are 100 years old with long COVID. It affects people across the lifespan and across demographic groups. The burden of long COVID, the burden of disease and disability from long COVID, when you measure it, is on par with the burden of cancer and heart disease. And even if people emerge unscathed after having the first infection, they can still get long COVID after reinfection. And I don't think enough people really know this fact or know about this. Recovery rates of long COVID are also low. Between low rates of recovery from long COVID and the cases that are due to reinfection, we're supposed to see continued rise in the burden of long COVID until we find better ways to prevent it and treat it. Now, you should be asking me now, how do we prevent long COVID? Well, the best way to prevent long COVID is to prevent COVID in the first place. There is actually no long COVID without COVID. You know, if you go back to 2019, you go back to 2018, none of us have heard of long COVID. Have you? You haven't. It didn't exist. There is no long COVID without COVID. We need a sustainable, multi-pronged approach to prevent repeated infections that would be embraced by the public. This requires accelerating the development of oral intranasal vaccines that block infections. This is very, very, very important. Ventilation and air filtration systems are also very important. They can play a major role in reducing the risk of transmission of airborne pathogens. We also need variant-proof vaccines. What the virus is doing is really continuing to mutate on us. You know, every few months, you're going to see a new variant. We need a variant-proof vaccine that lasts for a long time, that is durable, that offers durable immunity. People are sick and tired of having to have boosters every few months. We need vaccines that last for 5 years or so they can get it done and get it over with for 5 years. We must also understand vaccine side effects. This must be acknowledged and understood very, very deeply. This is very, very important. Now, you should be asking me also, like, how do we treat long COVID? You've heard it before. There are zero approved medication for the treatment of long COVID.